We're on our fourth part on the topic on Shen. Previously, we end with the note that all emotions affect the heart, explaining why a red-tipped tongue is commonly seen even in emotional problems related to other organs. Today, we'll start off our discussion on Shen disturbances and how will this manifest on the tip of the tongue. Generally speaking, the progression of severity of emotional stress according to the tip of the tongue is as follows. We'll start with a red tip with a normal body color. And then it will turn into a red body color with a redder tip. Later, the red body is still with red body color, but the redder tip will present with red points. After that, it's still red body color, but the tip will be redder and swollen. Later on, the tongue will still have a red body color, a redder tip, a swollen tip with red points. And then the tongue will have a red body color, redder tip with red points, and then it will present with heart crack. After that, a red body color, redder and swollen tip with red points, and a deeper heart crack. These are the pictures of the tongue and its tip as it progresses from a normal body color with a red tip, a red body with a red tip, a red body with a tip and red points, a red body with red swollen tip with red points, a red body, red tip with heart crack, a red body, red tip, a stomach heart crack with sticky and dry yellow coat inside it. Now let's discuss on the swelling of the tip. A swelling in the tip indicates emotional stress affecting the Shen. It usually appears in conjunction with a redness of the tip, like as shown in the pictures. Now let's have a case study here. The tongue description is this is a 39-year-old female patient. The tongue description, reddish with a deep crack in the center, a peeled coating at the root, curled up slightly red edges, and a red tip. Her symptoms presents red, itchy, dry skin at neck and face, sensations of heat in the body, and depression. Western diagnosis of her condition is atopic eczema, allergic rhinitis, and allergic asthma. Background to the disease, she has weak constitution, repressed emotions, and unhappy marriage. In TCM diagnosis, there is slight heat in blood, stomach deficiency, kidney deficiency, liver qi constraint with heat in liver, and heat in the heart. As for her case history, Mrs. S suffered from atopic eczema since age 25. Whenever she encountered emotionally difficult situations, her skin immediately turned red and dry and became very itchy. Her skin was particularly red around the neck and face. For many years, she used large amount of cortisone creams to improve appearance of her skin. Her marriage proved to be a great strain on her as her husband became mentally ill. She was very anxious and fearful and unable to express her frustrations and anger. In general, she felt very unhappy and experienced times of deep depression. As a child, she experienced frequent asthmatic attacks and acute bouts of allergic rhinitis, but they rarely manifested in adulthood. Red's tongue showed a very deep crack in the center. Tip was very red. Her pulse was very rapid, thin, and slightly wiry. Analysis of her condition. First, the energetic condition of this patient can be characterized by deep constraint of liver qi with development of heat. Curled up and slightly red tongue edges confirm this diagnosis. They appear when long-standing emotional problems cannot be resolved. Here, heat and blood is mainly responsible for condition of her skin. Over many years, blood and fluids in superficial layers of body were injured by heat, which manifested as dry, red skin. This woman was always sick as a child and had weak constitution. This, together with application of cortisone cream for over 20 years, were main factors underlying weakening of stomach and kidney yin. Rootless coating of tongue is important indication of their deficiency. Deep crack in the center indicates stomach yin deficiency. Kidney yin deficiency and internally generated heat disturb organs' harmonious communication with heart, manifested in anxiety and depressive states. Rapid and thin pulse denotes heat from deficiency due to lack of yin. Wiry quality suggests liver qi constraint. In summary, center of tongue should be moist and show a thin coating. In stomach yin deficiency, cracks or dryness will appear in this area. Improper diet, as well as eating in a hurry, too late, or irregularly may be important factors in the development of this deficiency.